You have a 47-year-old male who presents with severe sharp epigastric pain. It started suddenly while he was at rest. The pain is associated with shortness of breath and sweating. He has a history of hypertension and hyperlipidemia. And this is his ECG. I'm going to show you the ECG, a bigger form. What's the most likely diagnosis? A, gastroesophageal reflux disease. B, acute pancreatitis. C, acute myocardial infarction. D, peptic ulcer disease. What's your answer? And let me go to the next slide so that you see the ECG better. You see the ECG better. So it looks like there's some, I'm not going to say it. Who can tell me what they see on the ECG? You can just type your answer. What do you see on the ECG? Is it a simple sinus rhythm? Is it atrial fibrillation? Is it VTAC? Is it VFib? What is happening on the ECG? What is happening on the ECG, doctor? What is happening on the ECG? What is happening on the ECG? What is happening on the ECG? Beautiful. Inferior myocardial infarction. So what's the most likely diagnosis? The most likely diagnosis is C. It's a case of acute myocardial infarction. Acute myocardial infarction. It often presents with severe epigastric pain in some patients. So it's not every epigastric pain which is as a result of a gastrointestinal issue. So this question was to let you know that there are other, causes of abdominal pain which are not as a result of abnormalities in the GI tract. That is the essence of this question. So if you have a patient with epigastric pain and elevated troponin level, or ECG shows ST segment elevation in corresponding leads like lead 2, lead 3, and lead AVF, which indicates an inferior MI, boom, that is myocardial infarction for you. GERD does not cause some systemic symptoms like shortness of breath. Pancreatitis causes more abdominal pain, which radiates to the back, but does not lead to ECG changes. And peptic ulcer disease as well does not lead to ECG changes. So doctors, you understand what is happening there. So now let's do a deep dive into epigastric pain and vindicates. You have a patient who develops bloating easily, and the patient is diabetic. Please think about gastroparesis as one of your differentials. That's one thing you want to note. And then autoimmune causes. Think about autoimmune gastritis. So these people present with gastritis symptoms, but then it has an autoimmune source. So that's also something you want to think about. And then trauma, if the patient was maybe sitting in a car, the patient hits the chest or the upper abdomen on the steering wheel, or the patient fell, blunt trauma, or the patient was hit by a ball or a bat or something, or an object. Think about this. And that can lead to pancreatic injury, which can lead to epigastric. And then degenerative causes.